and pay the bills.
What's in a penny? The British Medical Association says a pret-a-manger barista earns more than a junior doctor.
Every year, 161,000 doctors across the UK are forced to pay £161 to their regulator. That's the General Medical Council. They make sure doctors follow medical ethics, keep patients safe, fight disease. But here's what they don't tell you. A Freedom of Information request just exposed something absolutely mental. The GMC took doctors' money, nearly £870,000 of it, and invested it directly into McDonald's, Coca-Cola, PepsiCo, and Nestle. Think about this for a second. Doctors on the left are treating diabetes, heart disease, and obesity. The companies literally causing these diseases are getting funded by the doctor's own regulator. But it gets worse. The GMC handed £50 million to investment firm CCLA in 2019. By 2023, that portfolio was worth £57.6 million. And buried inside that portfolio, investments in the exact industries doctors are supposed to regulate independently. Doctors are calling it a betrayal. Health experts are horrified. And the GMC, they're defending it as good business. This is the story of how Britain's medical watchdog became the thing it was supposed to watch. Let's start with something most people don't know. Being a doctor in the UK comes with a price tag that has nothing to do with medical school debt. Every single practicing doctor is required to pay the General Medical Council £581 per year. That's £475 for annual registration, plus an additional £106 for what they call professional development. Now, you might think this money goes towards important things like medical research, training programs, or healthcare infrastructure. That would make sense, wouldn't it? After all, we're talking about the organization that licenses doctors, investigates medical complaints, and supposedly upholds the highest standards of medical ethics. But wait, the story takes its first dark turn here. The GMC doesn't just collect these fees and spend them on operations. Instead, they've been quietly building a massive investment portfolio. $57 million in accumulated wealth, all extracted from doctors who thought they were simply paying for professional oversight. Every doctor fighting obesity has been forced to contribute to this fund. Every physician treating diabetes patients has no choice but to pay in. Every medical professional who witnesses firsthand the devastating effects of processed food addiction and pharmaceutical dependency, they're all trapped in this system. The GMC presents this as routine asset management, protecting funds from inflation. But what they don't advertise is where exactly those assets are being protected. And that's where this story transforms from administrative oversight into something far more sinister. In March 2023, journalists finally got their hands on the GMC's investment records through Freedom of Information requests. What they found was so shocking that it left medical professionals questioning everything they thought they knew about their own regulatory body. The numbers tell a story that's almost too absurd to believe. The GMC had invested £264,000 in Starbucks, a company that peddles sugar-laden drinks to millions of people daily. They put £127,000 into McDonald's, the global symbol of processed food culture. Coca-Cola received £114,000 of doctors' money, while PepsiCo got another $127,000. The pharmaceutical investments were even more staggering. AstraZeneca, Merck, Novo Nordisk, and Roche collectively received over £1.2 million from the GMC's portfolio. These are companies that directly profit from treating the very diseases that junk food creates. The GMC also invested £470,000 in private insurance companies, the same companies that often deny coverage or create barriers to the healthcare that doctors are trying to provide. They also funneled £1.3 million into medical device manufacturers, creating yet another layer of profit from human suffering. Let's put this in perspective. The GMC invested more money in Starbucks than they did in Amazon. They put more faith in McDonald's stock than in renewable energy. They were literally betting on the success of companies that create the health problems their members spent their careers trying to solve. It's like discovering that fire departments have been secretly investing in arson equipment, or that environmental agencies have been buying stock in oil spills. The contradiction is so stark, it feels like satire, except it's devastatingly real. Now here's where the GMC's hypocrisy reaches almost comedic levels. They actually have what they call an ethical investment policy. On paper, this policy excludes investments in tobacco companies, weapons manufacturers, and gambling operations. The GMC proudly states that they won't invest in anything that contradicts their mission to protect public health. Tobacco is out because it causes cancer and addiction. Weapons are excluded because they cause harm and death. Gambling is forbidden because it destroys families and creates dependency. These exclusions make perfect sense for an organization dedicated to medical ethics. But somehow, junk food companies didn't make the cut. Companies that spend billions marketing addictive processed foods to children? Perfectly fine. Corporations that engineer products to maximize cravings and minimize nutritional value? No problem whatsoever. The pharmaceutical giants that create dependency on medications while suppressing research into preventive care? They're apparently ethical enough to deserve doctors' money? Sam Everington highlights that investing in fast food companies is no different to investing in tobacco companies. And he's absolutely right. The only difference is that tobacco kills you faster, while processed food and pharmaceutical dependency kills you slowly while extracting maximum profit along the way. The GMC's ethical policy is deliberately blind to the most profitable forms of harm. They've created a system where quick, obvious killers are excluded, but slow, profitable killers are embraced with open arms. When news of these investments broke, the medical community's response was swift and furious. They weren't just abstract ethical concerns, they were personal betrayals, felt by thousands of healthcare professionals who had been unknowingly funding their own professional contradictions. Many doctors whose work involves dealing with the harms caused by junk food marketing would, if they knew, despair at how their money is being invested, says Martin McKee, professor of European Public Health. Dr. Margaret McCartney raises an even more fundamental question. It is unclear to me why the GMC holds so much money and why it has chosen to invest as it has. It's a brilliant point. The GMC is supposed to be a regulatory body, not an investment firm. Their job is to oversee medical practice, not to play the stock market with doctors' mandatory fees. The outrage was about the complete lack of transparency. Doctors weren't told where their money was going. They weren't given a choice in how it was invested. They weren't even informed that significant investment activities were taking place. Doctors are required to declare any financial conflicts of interest that might affect their patient care. Yet their own regulatory body was secretly creating massive conflicts of interest on their behalf. These weren't just professional complaints. They were expressions of genuine moral distress from people who had dedicated their lives to healing, only to discover they were being forced to fund the systems that create sickness. The economics become truly disturbing here. What the GMC created was a perfect profit loop that benefits from human suffering at multiple levels. The cycle works like this. Junk food companies create products designed to be addictive and nutritionally destructive. These products drive obesity, diabetes, heart disease, and a dozen other chronic conditions. The NHS then spends massive amounts of money treating these preventable diseases. $74 billion per year just on obesity-related conditions alone. The pharmaceutical companies that profit from treating these diseases are often the same companies invested in the GMC's portfolio. So the GMC benefits when junk food companies succeed in making people sick. And they benefit again when pharmaceutical companies succeed in treating the resulting illness. It's a financial incentive structure that literally rewards sickness and punishes health. The GMC's investments perform better when more people become diabetic, obese, or chronically ill. Their portfolio grows stronger when public health grows weaker. And you know what? All the doctors, they are all trapped in the middle, forced to fund both sides of this equation while watching their patients suffer from entirely preventable conditions. They're paying for the problem and the solution, while the real beneficiaries are the shareholders and executives who profit from human misery. Let's get this straight. This isn't a conspiracy. Oh no, it's just capitalism operating exactly as designed. with the GMC serving as an unwitting middleman in a system that monetizes human suffering. The most critical aspect of this entire scandal is how it came to light. The GMC didn't voluntarily disclose these investments. They didn't proactively address the obvious conflicts of interest. They didn't even publish their investment holdings where doctors could see them. It took journalists from the BMJ, the British Medical Journal, filing Freedom of Information requests to expose what was happening. Think about that for a moment. The organization responsible for medical transparency and ethical oversight had to be forced by journalists to reveal basic information about how they were using doctors' money. When confronted with the evidence, the GMC's response was textbook corporate damage control. They claimed they were simply protecting assets from inflation, and that their investments were diversified and balanced. They treated legitimate ethical concerns as if they were minor accounting questions. They said they might review their investment policy sometime in the future. Not will review, might review. And not immediately, next year. Not a fundamental change in approach, just a review that might or might not lead to minor adjustments. Don't you think? This is the organization that holds doctors to the highest ethical standards. Yet their own response to a massive ethical violation was to essentially say, we'll think about it and get back to you. The GMC's reaction revealed something crucial. They viewed this as a public relations problem, not an ethical crisis. They were more concerned with managing the story than addressing the fundamental contradictions in their investment strategy. If an organization specifically tasked with maintaining ethical standards can operate with such obvious conflicts of interest, what's happening in less scrutinized institutions? The GMC doesn't publish their investment holdings online. Most doctors had no idea their fees were being used for investment purposes, let alone which companies were receiving their money. This level of financial opacity would be scandalous in a private corporation, but it's apparently acceptable for a public regulatory body. This lack of transparency isn't accidental, it's systematic. The GMC operated for years with the assumption that doctors would simply pay their fees and never ask questions about where the money went. They counted on professional compliance and public indifference to maintain their profitable arrangements. Now, the truly disturbing thing is that the GMC is not unique and not alone. Across the UK, professional regulatory bodies, government agencies, and public institutions manage billions in investments with minimal oversight or transparency. The GMC scandal might be the tip of a much larger iceberg. Just consider the broader implications. If medical regulators can secretly profit from junk food companies, what about environmental regulators? If the people overseeing public health can invest in pharmaceutical giants, what about the agencies managing pension funds or educational trusts? The GMC's investments were only exposed because journalists specifically targeted them with Freedom of Information requests. How many other regulatory bodies are operating similar schemes without any public scrutiny whatsoever? What we've learned today is that the GMC scandal isn't just about money or investments. It's about the fundamental breakdown of trust between institutions and the people they're supposed to serve. When regulatory bodies become profit centers, when ethical oversight becomes a business opportunity, when public service becomes private enrichment, the entire system loses its legitimacy. Now, before you go feeling bad for them, the GMC wasn't just careless or negligent. Their investment strategy was deliberate and strategic. They made conscious choices to exclude tobacco while embracing junk food. They decided pharmaceutical investments were ethically acceptable while maintaining strict standards for medical practice. The doctors trapped in this system represent something larger. They're symbols of how professional integrity can be undermined by institutional corruption. They dedicated their lives to healing, only to discover that their own regulatory body was profiting from the systems that create sickness. Economic systems only function when the people in charge are accountable to the people they serve. But what happens when those in charge have financial incentives that directly contradict their stated mission? What happens when the watchers are watching their investment portfolios instead of the people they're supposed to protect? The GMC scandal forces us to confront an uncomfortable truth. And let's face it, in a system where everything is commodified, even our protectors become predators. The organizations we trust to maintain ethical standards may be the very ones profiting from ethical violations. And that brings me to the final question. If we can't trust the people who regulate trust itself, who's left to watch the watchers? The answer might be more disturbing than the scandal itself, because increasingly, the answer appears to be no one at all. The GMC story is over, but the questions it raises are just beginning. In a world where profit motives infiltrate every institution, where conflicts of interest are normalized, where transparency is treated as optional, the real scandal isn't what the GMC did. The real scandal is how normal it's become.